Okay, today we'll continue with our fourth lecture on behavioral science. Remember that all these lectures are pretty much preparation for the USMLE. So after we cover the main topic of today, at the end we'll do some review questions with questions that resemble the ones that appear at the USMLE Step 1. So last class we talked about developmental psychology, and we argued that it is a very important field of psychology. It's basically about the most important milestones that an individual achieves throughout his or her lifetime. And doctors need to be aware of this because as you keep track of what, especially pediatricians, as pediatricians keep track of what children do and how they behave, then that's a guideline to consider what's normal and what's not. And if some of those milestones are not met, then that's a concern for most of the time for neurological concerns. So maybe if some of the reflexes don't appear, then that may require some further neurological studies. Now, developmental psychology is mostly concerned with childhood, but not exclusively concerned with childhood. There are other times in a person's lifetime that are also important for developmental psychology. So today we will cover the second part, which is school age, adolescence, and adulthood. In the previous lecture, we talked how the individual develops from the time they're in the womb, during pregnancy, all the way until school age. From now on, we'll pick it up from there, and we'll study some of the behavioral tendencies of people in different ages, how they behave differently, and what's expected from them, especially in a medical context. So let's pick it up where we left off last time, and that is school age, which is roughly from 7 to 11 years old. Well, this is a time when children begin to develop different social characteristics. Children prefer to play with children of the same sex. So there really is not much of an interest in children of the other sex. This is picked up in adolescence. And early childhood also is a time when children are interested in, it's not that they're really interested, but they don't mind playing with children of the other sex. But from 7 to 11 years old, that's the typical time when children prefer to play with other children of the same sex. This is also a time when children identify with the parent of the same sex. According to Freud, during the Oedipal stage, and we call it Oedipal because of the Oedipus complex, which according to Freud is the unconscious tendency of children to have a romantic attachment to the parent of the opposite sex and to have some conflicts of the parent with the same sex. But by the time they're from 7 to 11 years old during school age, children have already overcome that Oedipus complex and they prefer to interact more with the parent of the same sex. So girls feel more attached to their mothers and boys feel more attached to their fathers. And you can see this throughout the media and also in everyday experience. I mean, this is a time when little boys engage in little league baseball and things like that, and fathers become engaged with them, and little girls they become involved in ballet or other girl activities, and then it's usually the mothers who become engaged with this, because this is a time when also gender identity begins to come in. So the children begin to have a sense of who's a boy and who's a girl, who's a man and who's a woman, and that's how they identify with parents of the same sex. This is also a time when children have a relationship with adults other than parents. So they begin to interact with teachers, with group leaders. So, they are way past beyond the stranger anxiety that we talked about in the previous lectures. And they don't have so much a separation anxiety with their parents. I mean, it's okay for them to drop them off at school and they'll be fine. So they don't have a problem. They're able to interact with other adults, and not just with their parents. And they also begin to show they also show little interest in psychosexual issues. I mean, this will be picked up later on in adolescence. And this is important to make a sociological critique of our society, because a lot of people have claimed that our society is overly sexualized when it comes to children. I mean, you can see, for instance, that picture in this slide of children who are sexualized for publicity. Now that brings problems. I don't know if you remember, there was a famous case in the United States of Jean Bennett Ramsey. She was a little girl, she was about 6 or 7 years old, who was a model, and she was brutally murdered. And nobody really found out who the murderers were. But even if her parents were accused of killing her, but they were never really formally charged. And there were some doubts about who really committed this murder. But regardless of who the murderers were, I mean, the case really caused a sensation because that poor little girl was overly sexualized. And I think doctors and sociologists should criticize our modern society for the way it sexualizes children. Now, I haven't seen any formal studies making a link between rates of pedophilia and the over-sexualization of children in society. But my guess would be that there should be some correlation. So this is something that U.S. doctors should take issue with. I mean, the idea that our society is overly sexualized, and you should understand that in terms of public health, this is not good for society. I mean, children, it is not normal for children at this stage of their lives to be interested in sex. So those media images that over-sexualize children should be really criticized. Also, during this time of their lifetime development, children have a internalized moral sense of right and wrong. This is when children begin to understand that there's such a thing as morality, that, you know, lying is not good, that hitting other people is not good, that you have to respect other people's property, other people's rights, and so on. When children do not have this internalized sense of moral right and moral wrong, then that should be a motive of concern, especially for psychiatrists. Later on, when we take a look at the DSM-5 and some of the disorders that originate in childhood, we'll take a look at conduct disorder. And conduct disorder is basically an absence of internalized moral sense of right and wrong. And usually, if conduct disorder is not properly treated or taken care of, although it's very difficult to treat this type of disorder, there is a high probability that conduct disorder will eventually turn into antisocial personality disorder, or psychopathy, as sometimes it's known. So this is something to watch for, because I mean, there's a potential for children who do not develop at this stage a moral sense of right and wrong, who just enjoy hitting other people and bullying other kids and not understanding that other people have rights. And that also carries the danger of extending into adulthood, and these people becoming psychopaths or people with antisocial personality disorder. So this must be a warning sign. Now, when kids at this stage have an internalized sense of moral right and moral wrong, even if they begin to understand the difference between good things and bad things, their moral sense is still a little bit different from adults. And Jean Piaget, who was a psychologist that we mentioned in the previous class, he dedicated a lot of study to how children internalize moral senses. Because in Piaget's studies, he came to discover that when children understand morality, they have an immanent and authoritative sense of justice. I mean, they believe that things are good or bad, not because they're inherently good or bad, but actually because an adult says that something is good or something is bad. So when you ask a small child, why is robbery not good? Then the child will not say, well, because other people have rights, but more because, oh, because the teacher said that we should never rob. So, you know, they depend on the adults' authoritative commands in order to internalize a sense of right and wrong. And they also have a sense of immanent justice. Immanent justice is the idea that whoever does a bad deed will be immediately punished. So it is very normal for kids to believe that if they do a bad action, they will be immediately punished either by God or by the universe, or that something bad will happen to them. And of course, we as adults know that that's not the way things work. I mean, you can be a bad person and not necessarily something bad will happen to you. It requires a little bit of moral maturity to understand that, you know, the world is not perfect and that justice is not immanent, and that, you know, that there will not be immediate bad consequences for bad deeds. Now, an important aspect in moral development is that when children overcome immanent and authoritative justice, so by the time they're about 8 or 9, they begin to understand that people have rights regardless of what adults may say. I mean, there are good and bad things, not just because some person with authority says it so, but because that's the way things really are. That's the nature of things. And they also come to understand that justice is not necessarily immanent, but that nevertheless, they still have to do the right thing. Okay, during this time, children also go through some cognitive maturation. So they begin to be more industrious and organized. So this is a time when they begin to do homework. I don't know in the US, but in Europe there is a long discussion, a political discussion, about whether or not children should be assigned homework in elementary school. And parties of the left, I'm thinking especially in Spain, there's a party who's very famous for this, parties of the left think that children should not be assigned homework. Now, I'm not really sure what the consensus among the educational psychologists is, but it is a fact that children begin to have a cognitive transformation in school age and that they're more able to be more organized and to be more industrious. And also, as Piaget mentioned, we talked about it last class, they begin to have a capacity for conservation and for basic logical thought. Now, capacity for conservation, remember, is the understanding that objects preserve either their size or their form despite some changes. So if you take water from one elongated glass and you pour another glass with that same water, which one of the two glasses has more water? Well, we adults understand that it's the same volume of water, whereas younger children have a harder time understanding this. So during the school age, from 7 to 11 years old, children began to understand that it's the same volume of water. Now, this is an important milestone. It's an important cognitive milestone because people, they begin to understand how objects behave, how things work out, and they begin to develop the basis of a logical thought. So they can solve some relatively easy abstract problems, whereas younger children don't have that ability. So the time to be teaching math and logic is around school age. Prior to school age, it's a little bit more difficult because children do not yet have the cognitive capacity to do so. Okay, let's talk about early adolescence, which is the age that follows school age. Early adolescence, or puberty as it is called, is conventionally set from 11 to 14 years old. So this is a time when primary and secondary sex characteristics appear and when there's also skeletal growth. So when someone is 25 and when they turn 29, there's not much of a difference between being 29 and 25 years old. But when a kid is 11 and then 4 years later, when he's 15, there is a huge difference in size, and this is due to skeletal growth. So skeletal growth is quite prevalent during early adolescence, during puberty. Some physicians have developed what's called the Tanner scale of sexual development, and this is a scale that measures how some primary and secondary sex characteristics are developed in children in the ages of early adolescence, both boys and girls. So let's consider some of these changes in sexual development according to the Tanner scale. Well, first of all, the genitalia and associated structures are the same as in childhood during the first stages. So the nipples are slightly elevated in girls. Later on, we can find scant, straight pubic hair. In the cases of boys, the testicles, the testils enlarge, and the scrotum, which is of course the sac that involves the testes, and the scrotum develops texture, so it becomes a little bit rugged. And in girls, there is a slight elevation of breast tissue. So you can see here a picture of the Tanner scale of development, the 5 stages. This is for women, so you can see that their breasts begin to grow a little bit. During the earlier phases, the nipples are slightly elevated, but later on they tend to lower their level a little bit, and there is a growth of pubic hair. This is for the case of girls. In the case of boys, pubic hair increases over and it becomes curly. The penis increases in length and the testes enlarge. Also, the penis increases in width, the glands develop, and the scrotal skin darkens. And in the case of girls, the areola rises above the rest of the breast. Male and female genitalia later on are like adult, and pubic hair now is also on thighs. And in the final phases of sexual development, the areola is no longer elevated above the breasts in the girls. So here you can see a picture of sexual development according to the Tanner scale in boys. You can see how both the penis and the testicles within the scrotum become bigger. The scrotum becomes a little bit more rugged in texture, and pubic hair begins to grow, and also the color of the scrotum begins to darken a little bit. And here's another picture comparing boys and girls' sexual development. For girls, usually on average, the first menstruation is around the time they are 11 years old. Of course, there are some variations. I mean, there are some girls who have the menstruation a little bit earlier, and there are some variations that have the menstruation a little bit later. And this has some socioeconomic correspondence. For the most part, now this is not an absolute correlation, but for the most part, in socioeconomic groups or in countries that do not have a high standard of living, menstruation usually comes a little bit earlier. Now, we may not be absolutely sure why that is. It may have something to do with nutrition. We're not sure. But although it's not an absolute perfect correlation, there is some correlation between low socioeconomic status and early menstruation. As for ejaculation, the first ejaculation comes a little bit later in boys. It can be it's usually around 13 years old, and this varies across boys. I mean, for some boys it's a nocturnal emission. For other boys it comes from masturbation, and from yet some other boys the first ejaculation comes from the first sexual contact. I would say most boys will have their first ejaculation due to nocturnal emission. Also during this time, in both boys and girls, there is a cognitive maturation. So boys and girls begin to understand the world a little bit better. They have more cognitive abilities for logical thought and so on. And this is also a time when personality begins to be formed. So some of the personality traits that will be retained all throughout adulthood, they begin to appear during early adolescence. And as you can expect, along with the changes in the genitalia, there is also a change in sex drive. So this is when kids begin to be interested in sex. By the way, the sex drive is not so much related to the genitalia. Well, it is related to the genitalia, but it's also related to the brain. And this is one of the great criticisms of Freud and psychoanalysis. Freud alleged that children in very early ages have some sexual interests, but a lot of neuroscientists have criticized him for saying that, you know, children's brain are not really prepared for sexual interest, so it's very unlikely that children have a genuine sexual interest, as Freud claimed. Really, the sex drive begins during early adolescence, which is between 11 and 15 years old. This is also a time of high peer pressure. It, you don't have to be a genius or an acute sociological or psychological observer or a great physician to understand this. I mean, you can see it all over, that this is a time when kids pay a lot of attention to what other people say about them. And you can see an image there of teenagers drinking, and usually that's how people begin to drink. I mean, no one really begins to drink or to smoke on their own. It's always the group that's pressuring the individual to do so. And of course, this is in a time of life when teenagers or adolescents are very much concerned about what other people will say of them. So if everybody else is drinking and they don't drink, then there will be a big psychological problem for them. So they will feel very much pressure. So this is why psychologists and counselors and physicians need to be aware of this, because they need to work with teenagers understanding that they are under severe peer pressure. Now, there is a cultural side to this. There have been some anthropologists that say that adolescence is not the same across the whole world. And there are some areas where peer pressure is not as intense as in other countries. So, for instance, there was a famous anthropologist, her name was Margaret Mead. She went to study in Samoa, and there she discovered that early adolescence was not as problematic or as traumatic as it appears to be in the West. I mean, there was some peer pressure, but it was not as intense as it is in the West. So there is a higher risk of psychological problems due to physiological changes during adolescence. So yeah, of course, I mean, when you begin to understand, and you as a teenager begin to understand that your body is going through some changes, and you begin to develop acne in your face, which can, you know, significantly affect your body image. You begin to have voice change, so you're used to listening to yourself with one voice tone, and all of a sudden you speak differently. Your body weight may increase. You may have other body changes. That's very difficult to cope with from a psychological point of view. So all these physiological changes have a higher risk of turning into psychological problems. But again, I want to emphasize that this may have a cultural correspondence, because there are some anthropologists who say that the physiological changes in adolescence are indeed universal, but that doesn't necessarily lead to psychological problems in other societies. So the psychological problems derived from physiological problems seems to be more of a specific problem in Western society that may not be as common in other societies. Now, there are some anthropologists who have criticized this view of adolescence not being universally problematic. So it's a debate. I mean, there are some anthropologists who believe that yes, it is universally problematic, and there are some other anthropologists who say that no, it isn't. And it's important to point out that the anthropologist that insisted the most on the fact that adolescence doesn't need to be problematic in all countries, and this anthropologist was Margaret Mead. Later on, it was discovered that she lied and that she made up some of her data. So that is why her studies are not very trusted, and that it does seem like adolescence problems are found throughout every culture. Okay, let's talk about middle adolescence, which is the time from 14 to 17 years old. Well, during this time, there is a greater interest in gender roles, and this is when people begin to develop a stronger sense of their gender identity and also of their sexual orientation. So here boys and girls begin to understand that society has ascribed some differences in gender roles. When we take a look at the DSM-5, we'll take a look at a disorder which is called gender dysphoria, and these are people who do not feel happy with their own gender, and they either require some surgical transformation of their genitalia and hormone treatment, or they may also require some psychological treatment in order to cope with this feeling of distress and unease, because they feel that they don't correspond to the gender that society has assigned to them. And some feminists agree that, or some feminists believe that many of these gender roles are arbitrarily set upon by society, and that actually it's a way of men dominating women. This is what they call a patriarchal domination. Now, leaving that aside, and we can have a philosophical and sociological discussion about whether or not gender roles are socially constructed or whether or not they have a basis in reality and biology. Leaving that aside, the fact is that our culture sets some gender roles for one gender and some roles for the other gender. And the period of middle adolescence, which is from 14 to 70 years old, that's when kids begin to understand that society expects something of men and something of women, and that's when they begin to develop an interest in gender roles. So the sexual interest or the sexual curiosity that begins in early adolescence is further developed in middle adolescence. So this is when kids may begin to have sexual relationships, and when they begin to interact with people of the other gender. Although this is the era when, this is the time when there is a greater interest in gender roles and when people begin to define their sexual orientation, it must be said that sexual orientation is not fixed until much later. So amongst heterosexuals during this time, there may be homosexual contacts, because teenagers still don't know who they are. They're still developing their sense of identity, and they're still experimenting with new tendencies to find out who they are. So even amongst people who may eventually become fully heterosexual, during this time there may be homosexual contacts. And I wonder if any of you have seen this movie that we have in this slide, Moonlight. And this movie won recently the Oscar for Best Picture, and it tells a story of a boy who has some homosexual feelings, but eventually, apparently, he turns out to be heterosexual, but he did have a homosexual encounter with a friend. And later on, when he turns into an adult, after that homosexual encounter, he never had any other homosexual encounter, but he finds out the other boy with whom he had homosexual contact, and he has again a new homosexual contact. And the movie doesn't tell us if he turned into a full-blown homosexual or if he stayed heterosexual, but the fact is that sexual orientation is really a scale from, let's say, 1 to 10, and it's pretty much like a bell curve. I mean, most people are in the middle, so very few people are entirely homosexual, or very few people are entirely heterosexual. Most people are heterosexual, but during the time of middle adolescence, they may experience with homosexual contacts. And the other way around, I mean, someone may define themselves as homosexual, but maybe during middle adolescence they experimented with heterosexuality. Well, maybe they found out it just wasn't for them. This movie is especially interesting from a cultural perspective because the main characters are African American, and as you probably know, African American culture has been traditionally a little bit tougher with homosexuals. So, I mean, the main character of this movie has to go through some bullying from the other homophobes in his neighborhood, and he has it especially tough because being gay in African American culture is not easy, and all the hip hop stereotypes and so on. They're very hypersexual and to a certain extent homophobic. Not all expressions of hip hop, but many of them. So this movie is great in portraying how it is especially tough for someone that may have had some homosexual contacts in the black community. During this time, there's also the development of an identity, and as I was telling you in the previous lecture, this is the time when teenagers want to find out who they are. So they begin to experience with different types of music, and they form like urban tribes. The punks, the hip hoppers, the emos, the gothic people, the people who love Greek philosophy, and so on. Because this is a transition to the adult world, and the adult world is defined by many roles in society. So adolescents have to begin to find out who they are, what they want to be, and they begin to develop a sense of identity. And of course, this causes a lot of anxiety and stress because they're experimenting, they're trying to find out who they are. And during this time, adolescents may also take risky behaviors. So really the time of life when people do the most stupid things is most likely during the time of adolescence. That's when they begin to, they want to prove to other people what they're made of. But of course, they don't do it in a constructive fashion. They usually do it in a very destructive fashion. So they usually begin to take in behaviors that are associated with risk. And they begin to have a natural challenge of authority. Now, this is different from what the DSM-5 calls oppositional defiance authority. The DSM-5 has some specific criteria about how to diagnose that disorder. It's relatively normal for a teenager to challenge authority and not be content with receiving orders and so on. And that's why high schools, more than colleges or than elementary schools, have problems with discipline. And that's why I think that being a high school teacher is so challenging. I've never been a high school teacher, I think precisely because of that, because I wouldn't know how to handle a rebellious teenager. But it is a fact that during teenage years, especially late adolescence, people take risky behaviors, they run pranks, and they challenge authority. And I think you can also see it with all the problems because this is not something exclusive of high school. The early years of college are also a little bit like that. So all the problems with fraternities and sororities in campuses across America, in college campuses, I think that reflects this tendency of teenagers. And of course, there's a very famous movie about this. James Dean from the 50s. He played the main character in a movie with the title Rebel Without a Cause. And as the title implies, this was a story about a teenager who is just a rebel, who defies authority, not really knowing why. I mean, you may be a rebel against the system because you think that capitalism is bad. But unfortunately, many teenagers are against the system, not understanding why they're against the system. And they're just rebellious. It's a natural development of their lifespan. So you should understand that when a teenager becomes rebellious and has problems with their parents and so on, well, you have to be a little bit more tolerant of that, because this is relatively common during this phase of life. During late adolescence, there is a lack of long-term goals, and I think physicians need to understand this, especially as a strategy to eradicate destructive behavior. So you're not going to persuade a teenager of a change in their behavior with long-term consequences. You have to point them out short-term consequences, because that's the way they think. I mean, they're not so concerned about what will happen to them when they're 40 or 50. They're much more concerned about what will happen to them almost immediately. So, for example, a teenager is more persuaded by black teeth than by lung cancer in deciding to stop smoking. So if you're a doctor and you're trying to persuade the patient who's a teenager to stop smoking, well, you shouldn't tell him about the risks of lung cancer, because that's far in the future. He doesn't care about that. Now you should try to persuade him more by telling him about the black teeth, And also, if I were the doctor, I would tell him, look, if you have black teeth, you're not gonna get any girls, so you should stop thinking about the smoking. And that's gonna be much more attractive for teenagers. It's also true that adolescents, related to this last point that I was making, adolescents have what's called in psychology delayed gratification. Now, delayed gratification is the maturity to understand that if you stop having some benefit or some gratification right now, that may be better in the future. And there have been experiments testing delayed gratification in people. There was a very famous experiment in the University of Stanford, which was called the Stanford Marshmallow Experiment. In this experiment, some kids were taken and they were offered two options. They could be given one marshmallow now or two marshmallows 15 minutes later. Now, the point of the experiment was to test the ability of these kids for delayed gratification. I mean, if these kids were able to hold on for a while and to suspend gratification so that later on they will get increased satisfaction, then that shows that they're a little bit more mature. And the results varied. Some kids took the marshmallow immediately, some kids waited 15 minutes later and they received the two marshmallows. Now, what was really interesting about this study was that after they performed this experiment, they kept track of the kids. And the results show that the kids with delayed gratification, that is to say the kids that took the marshmallows 15 minutes later, when they eventually grew up to become adults, they were less prone to risk-taking behaviors as teenagers and later on as adults. So delayed gratification is a very important aspect of maturity. And unfortunately, those kids who do not have the capacity for delayed gratification are at a greater risk of eventually becoming involved in risky behavior when they develop as teenagers. Okay, during late adolescence, from 17 to 20 years old, this is also a time when kids increase even more their sense of ethics. They have a self-control and understanding of their ability. So they begin to discover better who they are and what they're capable of doing. So this is a time when people have a great commitment to world causes and they become idealistic. And usually in political terms, you're more likely to find people off the left among younger groups than among older groups. It's because they're a little bit more idealistic. But this is a good thing. This is not a bad thing. I mean, I think idealism is a good thing. And I think that wanting to change the world for the better is a good thing. And I bet that many of you who are listening to this lecture, you want to become doctors because first of all, most of you are probably young. You're probably within 20 or 21 years old. And you want to make the world better by becoming physicians and helping other people. So that reflects idealism, and this is very typical of this time of life. Adolescents at this stage also begin to develop a greater capacity for abstract thought. So, things like calculus and algebra, it becomes easier for them. And they also have, some of them, what's called an identity crisis. And, this is the time when kids, or not so kids anymore, young adults, begin to develop a sense of who they are. And it's not easy finding out who you are. And not only in sexual terms, but also in every other sense. I mean, you, for instance, who are starting to become physicians, I bet that for some of you, it might be sometimes difficult to find out if you really want to be a physician, because it's a very demanding profession. So this is, for instance, these are called vocational crises. I mean, what do you want to be when you become an adult? It's not so easy to figure out. So this time of life, it's when these crises become more acute. If identity crises are not solved, then there may become role confusion. I mean, you're not sure who you are, what you want to be, and that may cause some distress. So, and also identity crisis may lead to criminality or even to reclusive behavior. I mean, people who are confused about their sexuality or about their vocation or about even their political orientation and so on, well, they may become so distressed that they just prefer to be reclusive from society. When we study the DSM-5, and we take a look at anxiety disorders, we'll take a look at agoraphobia, which is the fear of being in open public spaces, and also of being inscribed in the rest of society. And this may have a correspondence with identity crisis. I mean, if people are not sure who they are and they are confused and they are distressed because of that, well, they may be very reclusive. Or they may join cults or other very select societies so that they may find other people that very much as them are confused, and they may form a society of their own that is withdrawn from the rest of society. Let's talk a little bit about teenage sexuality. Usually the initiation of sex, this varies across countries. I mean, usually higher socioeconomic groups have a little bit more of a delayed sexual initiation. But on average, about 80% of people begin their sexuality when they're 19. Now, some of you may have begun earlier, some of you are still not sexually active. Anyway, it's your choice. But it's important to know that from a physician's point of view, that usually by the time they're 19, you should expect 80% of people to be already sexually active. 65% of sexually active teenagers do not use condom, and this is a matter of concern with STDs. So this is very much related to risk-taking behavior and not looking into consequences of the future. I mean, people with delayed gratification, they may think that putting on a condom is quite uncomfortable, and they would probably rather have the immediate pleasure of not wearing a condom than think about AIDS or gonorrhea or other STDs. So I think an important aspect here is developing psychological tendencies for adolescents to become more mature when it comes to delayed gratification, and to understand the risks of having unprotected sex. You have to remember that physicians may respect teenagers' autonomy when it comes to sex. So if a teenager comes to your office asking for some contraception, remember, even if they are under the age of 18, when it comes to contraception, they have autonomy, and they don't require the permission of their parents. We covered this when we talked about ethical principles in medicine. Okay, along with teen sexuality, we should also talk about teen pregnancy. There are many predisposing factors to teen pregnancy. One of them that I don't mention here in the slide, but I think it's worth mentioning, is again socioeconomic status. Countries with lower socioeconomic variables, with lower socioeconomic levels, and in industrialized countries, groups with lower socioeconomic status, they tend to have a higher risk of teen pregnancy. So if you go to Switzerland or to Sweden or Finland, over there teen pregnancy is not as big a problem as it is in Haiti or the Dominican Republic or Venezuela or Senegal or any other or some African country. Now, apart from those sociological factors, there are also psychological factors that predispose teen pregnancy. So first of all, there is depression. So girls who tend to be more depressed are more likely to be pregnant if they are teenagers. Poor school achievement, family conflicts. Yeah, if a girl is immersed in a lot of family conflict, well, maybe she will find some refuge in her boyfriend, and they will that increases the risk of having unprotected sex, and that may increase the risk of having teen pregnancy. It's important to keep in mind, you as physicians, that with teen pregnancy there is a higher risk of obstetric complications due to two factors. First of all, lack of prenatal care. Teenagers don't have the cognitive or the emotional maturity in order to understand the importance of going to the doctor while they're pregnant. And second of all, physical immaturity. I mean, their bodies are not fully prepared to withstand birth delivery. So they may be sexually active, they may be fertile, but not necessarily physically mature for a fully satisfactory for fully satisfactorily giving birth. So teen pregnancy has some high risks, and it's not a good thing. Let's talk also about an important topic that concerns you as physicians when it comes to development, and that is the attitudes towards life, towards illness and death. You need to understand how people understand illness and death as they grow up, because being based on that knowledge, you can cope with different strategies about how best to proceed with people of different ages. So when children are from a year and a half to 2.5 years old, uh, when these children are hospitalized, they fear separation from the parent more than they fear bodily harm. And remember, this is when they have a stranger anxiety and separation anxiety. So hospitalized children, they may not fear so much having surgery or having needles put on them. What they really fear is being separated from the parent, and you must cope with that. From 2 to 6 years old, the fear is not so much separation of their parents, but more a concrete fear of body harm. So this is when they really fear needles and getting their blood taken out for a sample and so on. I've had my kids right now are 4 and 6, and I can tell you that whenever I have to take them to receive a vaccine or to take a blood sample, it's quite stressful for them, because they're very scared of that. And well, it's understandable. I mean, you have to understand that that's relatively normal. During this time also there is no understanding of the concept of death. So children during this time, they may think that if a friend died, he will come back next week, or that if the dog died, that they may find it alive soon afterwards. There's no understanding of the concept of finality of death, that once someone is dead, he is dead, he will not come back. And some critics of religion say that religion is very childish in this regard. Now, I'm not here to sabotage anybody's religion. If you have your own faith, I respect it. I have no issue with that. But just to let you know that there are some critics of religion, some philosophical critics of religion, who believes in resurrections and immortality and so on, and the afterlife, are very childish, in the sense that 2 to 6 year old children, they also have no understanding of the concept of death. From 7 to 11 years old, well, this is the best time for elective surgery, because this is the time when kids cope well with hospitalization. So if a surgery is not an emergency, but it is nevertheless needed and it can wait, then it's better to wait until they're about 9 or 10 years old, because this is the time when they cope well with hospitalization. A little bit later on, it can have some physiological complications, but also some psychological complications, because older kids, when they become teenagers, they become more rebellious and they may be less likely to comply. So during adolescence, it's important for you doctors to understand that during this period there is a challenge of authority, both to parents and doctors. You have to remember that that U.S. doctors are also authority figures, and that you tell them what to do and what not to do. So because during adolescence there is a greater challenge of authority, so there is a higher risk of non-compliance. So this is something that you need to cope with and that you must be aware of. During this time, there is also the danger that kids may develop a defense mechanism, and we'll get back to defense mechanisms when we study psychoanalysis, but basically a defense mechanism is a way that people have with dealing with difficult situations. So if kids are going through some difficult situations during this time, they may act out, and acting out is a defense mechanism, and it's a defense mechanism that consists in bad behavior. So teenagers may have very bad behavior when they face difficult situations, such as a sick relative. So when kids do bad at school and they get into trouble, well, it's usually, not necessarily always, but many times it's due to the fact that something not well is going at home. Either the parents are fighting, or someone died in the family, or the family is very stressed because of a sick relative. So it's important for doctors to be aware of this. Let's also talk about adoption. Adopted children, particularly those adopted after infancy, they may be at an increased risk for behavioral problems in childhood and adolescence, because of course there is the identity problem. I mean, especially in adolescence. I mean, you want to find out who you are. If on top of that you have some confusion because your biological parents are not the ones who are living with you, and you may also develop a sense of having been rejected, then that may lead to more increased risk in behavioral problems. The best course of action here is that children should be told by their parents that they are adopted at the earliest age possible, to avoid the chance of others telling them first, and if that's the case, they may feel that their parents lied to them. So it's better to be honest and tell them as soon as possible. And also because as soon as they find out, then it will be less upsetting later on, and they may be better prepared to take in the news, and they may have more time to cope with this. It's important also for you to know as doctors that adoption carries some minor risks when it comes to domestic and child abuse. Evolutionary psychologists talk about the Cinderella effect, and this is the effect that due to evolutionary reasons, non-biological children are at a higher risk of being abused. So physicians must be aware of this when it comes to suspecting child abuse. I mean, if you suspect child abuse, and on top of that you find out that the parents are not biologically related to the children, evolutionary psychologists have documented statistically this so-called Cinderella effect. So it's something to watch for. Let's talk also about mental retardation, or as it is now called, intellectual disability. During cognitive development, there may be various causes of intellectual disabilities. Some of them are related to genetic causes. We'll take a look at them later on when we cover this in the DSM-5. But for the time being, it's important to know that there are two important genetic conditions that may cause intellectual disability or mental retardation. One of them is the Down syndrome, which is an additional chromosome 21. And there is also the Fragile X syndrome, and this is an additional nucleotide in the X chromosome. And people with this syndrome, the Fragile X syndrome, they usually have long and narrow face, they have large ears, flexible fingers, and large testicles. And as I was saying, there may be some mental retardation, some speech problems, or some lack of social interaction. Mildly and moderately mentally retarded children and adolescents, they commonly know they're handicapped. And unfortunately, that leads to frustrations, to poor social esteem, and to social withdrawal. So physicians need to be aware of this when coping with kids who are intellectually disabled. Usually they have an awareness of their condition, and that leads to further problems because of the difficulties in social interaction with other people. An important concern with intellectually disabled teenagers is the avoidance of pregnancy. So a recommended procedure here is, you cannot expect an individual who is mentally retarded or who is intellectually disabled to wear voluntarily a condom, because they may not be able to know how to do it, or girls to take some contraceptive medication. So probably the best resource here is a subcutaneous progesterone implant. And these are implants that are that serve as contraception. They usually last for 1 year, and they're implanted, usually on the arm. So in case that any of these individuals have sexual activity, then they may have already contraception in order to avoid pregnancy. However, this is a tricky situation because remember that there's the ethical concept of autonomy, and one should wonder whether it is ethical to impose contraception on someone who has not really asked for it. Now, one could make the case that people with mental retardation are not fully autonomous, as we covered it when we talked about in the lecture about ethical autonomy. So remember, those that are intellectually disabled and that are not mentally stable, it is ethically okay for others to decide on their behalf. So I would say that here we are in safe moral territory if it comes to putting some contraceptive device on intellectually disabled people who may run the risk of having sexual relations. Let's talk about now some of the developmental tendencies or behavioral tendencies in early adulthood, which is from 20 to 40 years old. Well, during this time, there is a reappraisal of one's life, so one's identity is already defined, and this is a time when people take full responsibility in their actions. The adult's role in society is defined, physical development peaks, and the adult becomes independent. This is also the time when there is a development of an intimate or a close or sexual relationship with another person. And this is the time when, according to Erickson's theory, remember we talked about it in the previous class, people have to decide whether or not to become intimate with others or to become isolated. So that's a major developmental task at this time of lifetime. Middle adulthood, that's between the ages of 40 and 65 years old. This is when people have more power and authority than at any other stage during life. So if you take a look at all the major head of states or presidents of colleges and so on, they usually tend to be within 40 and 65 years old. And there are some strange cases, such as the one in North Korea, where the president is very young. But in most other countries, it tends to be towards middle adulthood. That's when people have most power and authority. This is also the time when, according to Erickson, people have to decide whether or not they should have more generativity or stagnation. That is to say, when to step down and let other people take cover and come in. When should the new generation be allowed to step in? And that may cause some distress in people deciding that. So that decision is another huge developmental task. This is also the time when people go through some midlife crisis, although there are some myths about this. I mean, not everybody has to go through the midlife crisis, and it's not all about buying a convertible car and having an affair. And those are cultural stereotypes. I mean, that could definitely be part of it, but there are other ways of doing it. Or there are other ways of going through the midlife crisis. So it's by no means universal, but it is relatively common among people between 40 and 65 years old. And usually what happens is that there is infidelity, separation or divorce, there may be increased substance abuse or even depression. This is also the time of life when people have an awareness of one's own aging and death and severe or unexpected lifestyle changes. This is also the time of climacterium, which is the midlife change in physiological functions. In the cases of men, well, there's a decrease of muscle strength. You see Hulk Hogan, when he was at his peak, he was probably younger than 40. After 40, Hulk Hogan is not the attractive guy and the muscular guy that he used to be. And the same with Schwarzenegger or Vin Diesel and all those guys. And there is also sexual performance decreases a little bit. Although in the case of men, sexual performance, the decrease is not as dramatic as in the case of women. We'll talk about this when we get to the lecture on sexuality. In the case of women, there is a menopause, which is the beginning of ceasing of menstruation. This usually happens in the mid-late 40s. It's important for women, and you as physicians should be aware of this, that in order to avoid pregnancy, contraception should continue at least one more year after menopause. So just because you had menopause, that is no absolute guarantee that you will not be pregnant. You should, in order to avoid pregnancy, you should continue to take contraception at least 1 year after that. And during menopause, there's also what's called vasomotor instability, or the hot flashes. This is when women feel the heat. They begin to feel hotter than usual. And of course, this may influence their mood and their psychological status or their mental state. So it's important for doctors to make the husbands and other people aware of this. And they need to have additional patience and care of women who are going through menopause, because it could be a little bit of a challenge for them. Okay, so that wraps up our lecture. Let's do a couple of USMLE type of questions as preparation for your exam later on. So let's consider the first one. A 50-year-old male patient comes in for an insurance physical. Which of the following developmental signposts is most likely to characterize this man? A, decreased alcohol use? No, I wouldn't say so. Actually, people may begin to drink during middle adulthood because of some midlife crisis. Peak physical development? No, they're way beyond that. Peak physical development is usually the late 30s. So by the time they're 50, they are already decreasing in their physical development. C, possession of power and authority. I would say that's the most likely. You can see it across the board in many countries that people who are usually in charge are around 50 years old. D, strong resistance to changes in social relationships. No, that's more common during other times of life. People that are about 50-year-old are usually stable in their social relationships. And E, strong resistance to changes in work relationships. Not necessarily either. I mean, people are stable in their relationships, but they are more or less open also to changing work relationships. So I would say that here it's C, possession of power and authority. Let's consider another USMLE question. A mother tells the physician that she is concerned about her son because he consistently engages in behavior which is dangerous and potentially life-threatening. The age of her son is most likely to be A, 11 years old? No, not yet. I mean, this is the time when children may begin to develop some sexual curiosity, but not properly yet dangerous and risky behavior. 13 years old? Not yet either. I think that in order to answer this question, you could think of a Rebel Without a Cause movie. And how old was the character? Well, the character there was 17 years old. So I think the right answer here would be around 18 years old. That's the time when teenagers are more likely to be doing dangerous and potentially life-threatening behavior. If you watch Rebel Without a Cause, there is a part of the movie where they play the chicken game. And that's basically driving while your eyes are closed, driving all the way to crash with another car. Now, that's a very, very risky behavior. That's more typical of people who are about 18 years old. And let's take one more question and we'll finish with this. A physician discovers that a 15-year-old patient is pregnant. Which of the following factors is likely to have contributed most to her risk of pregnancy? A, living in a rural area. No, there really is no difference between rural and urban areas. However, there is a difference between higher socioeconomic status and lower socioeconomic status. People in lower socioeconomic strata have a slightly higher tendency of risk in teen pregnancy, of becoming pregnant while they're teens. Depressed mood, yes, I think this is the right option. Girls who are depressed have a higher risk of becoming pregnant. Intact parental unit, no, it's actually the opposite. I mean, if the parents are married and they have a good relationship with the children, it's less likely that the children will become pregnant. Usually pregnant girls come out of broken homes and so on. Achievement in school? No, absolutely not. I mean, if a girl is concentrated on her studies, it is less likely that she will have unprotected sex and become pregnant. And education about contraceptive methods? Well, obviously not. I mean, the better you're educated about contraceptive methods, then, the less likely will be that you may become pregnant as a teenager. Okay. Today we'll continue with our fourth lecture on behavioral science. Remember that all these lectures are pretty much preparation for the USMLE. So after we cover the main topic of today, at the end we'll do some review questions with questions that resemble the ones that appear at the USMLE Step 1. So last class we talked about developmental psychology, and we argued that it is a very important field of psychology. It's basically about the most important milestones that an individual achieves throughout his or her lifetime. And doctors need to be aware of this because as you keep track of what, especially pediatricians, as pediatricians keep track of what children do and how they behave, then that's a guideline to consider what's normal and what's not. And if some of those milestones are not met, then that's a concern for most of the time for neurological concerns. So maybe if some of the reflexes don't appear, then that may require some further neurological studies. Now, developmental psychology is mostly concerned with childhood, but not exclusively concerned with childhood. There are other times in a person's lifetime that are also important for developmental psychology. So today we will cover the second part, which is a school-age adult issue with. I mean, the idea that our society is overly sexualized, and you should understand that in terms of public health, this is not good for society. I mean, children, it is not normal for children at this stage of their lives to be interested in sex. So those media images that over-sexualize children should be really criticized. Also, during this time of their lifetime development, children have a internalized moral sense of right and wrong. This is when children begin to understand that there's such a thing as morality, that lying is not good, that hitting other people is not good, that you have to respect other people's property, other people's rights, and so on. When children do not have this internalized sense of moral right and moral wrong, then that should be a motive of concern, especially for psychiatrists. Later on, when we take a look at the DSM-5 and some of the disorders that originate in childhood, we'll take a look at conduct disorder. And conduct disorder is basically an absence of internalized moral sense of right and wrong. And usually, if conduct disorder is not properly treated or taken care of, although it's very difficult to treat this type of disorder, there is a high probability that conduct disorder will eventually turn into antisocial personality disorder, or psychopathy, as sometimes it's known. So this is something. They also show little interest in psychosexual issues. I mean, this will be picked up later on in adolescence. And this is important to make a sociological critique of our society, because a lot of people have claimed that our society is overly sexualized when it comes to children. I mean, you can see, for instance, that picture in this slide of children who are sexualized for publicity. Now, that brings problems. I don't know if you remember, there was a famous case in the United States of Jean Bennett Ramsey. She was a little girl. She was about 6 or 7 years old, who was a model, and she was brutally murdered. And nobody really found out who the murderers were. But even if her parents were accused of killing her, but they were never really formally charged. And there were some doubts about who really committed this murder. But regardless of who the murderers were, I mean, the case really caused a sensation because that poor little girl was overly sexualized. And I think doctors and sociologists should criticize our modern society for the way it sexualizes children. Now, I haven't seen any formal studies making a link between rates of pedophilia and the over-sexualization of children in society. But my guess would be that there should be some correlation. So this is something that U.S. doctors should take sense and adulthood. In the previous lecture, We talk how the individual develops from the time they're in the womb, during pregnancy, all the way until school age. From now on, we'll pick it up from there, and we'll study some of the behavioral tendencies of people in different ages, how they behave differently, and what's expected from them, especially in a medical context. So let's pick it up where we left off last time, and that is school age, which is roughly from 7 to 11 years old. Well, this is a time when children begin to develop different social characteristics. Children prefer to play with children of the same sex. So there really is not much of an interest in children of the other sex. This is picked up in adolescence. And early childhood also is a time when children are interested in, it's not that they're really interested, but they don't mind playing with children of the other sex. But from 7 to 11 years old, that's the typical time when children prefer to play with other children of the same sex. This is also a time when children identify with the parent of the same sex. According to Freud, during the Oedipal stage, and we call it Oedipal because of the Oedipus complex, which according to Freud is the unconscious tendency of children to have a romantic attachment to the parent of the opposite sex and to have some conflicts of the parent with the same sex. But by the time they're 7, from 7 to 11 years old, during school age, children have already overcome that Oedipus complex, and they prefer to interact more with the parent of the same sex. So girls feel more attached to their mothers, and boys feel more attached to their fathers. And you know, you can see this throughout the media and also in everyday experience. I mean, this is a time when little boys engage in little league baseball and things like that, and fathers become engaged with them, and little girls they become involved in ballet or other girl activities, and then it's usually the mothers who become engaged with this, because this is a time when also gender identity begins to come in. So you know, the children begin to have a sense of who's a boy and who's a girl, who's a man and who's a woman, and that's how they identify with parents of the same sex. This is also a time when children have a relationship with adults other than parents. So they begin to interact with teachers, with group leaders. So, you know, they are way past beyond the stranger anxiety that we talked about in the previous lectures. And they don't have so much a separation anxiety with their parents. I mean, it's okay for them to drop them off at school and they'll be fine. They don't have a problem. They're able to interact with other adults, not just with their parents. And they also begin to show little, well, actually,